Welcome to the ANZUP Evening Symposium, Survivorship Unmuted. It's great to have you all here. On behalf of ANZUP, I'd like to acknowledge the traditional custodians of the lands on which we're meeting, the Kaurna people of the Adelaide Plains, extend my respects to elders past, present and emerging, and extend those respects to any First Nations people here today, including Maori people, because we are ANZUP and we include New Zealand as well. So thank you for the privilege of being on these lands. Welcome to tonight. It's wonderful to have you all here. We've had a busy day and we're in for a fantastic session tonight. So my job is very brief tonight. I'm here to introduce Matthew Britland from AMGEN. AMGEN Oncology is the sponsor of our session tonight. So thank you very much to AMGEN and to all of our sponsors, but particularly tonight for AMGEN. Remember that name, AMGEN. Matthew is the medical director for AMGEN for hemato-oncology, and his primary responsibilities are for genitourinary cancer. So thank you, Matthew. Great to have you here, and I'll pass over to you.
Thank you, Ian. I've written a speech, actually, so hopefully you can give me about 3 minutes. I started working in oncology 20 years ago in a clinical role at the Christie Hospital in the UK, and it's been about 17 years of my career. In that time, we've seen obviously great advances in very innovative therapies and diagnostics. It's seen leaps in outcomes for patients, but we're nowhere near where we need to be, particularly with GU cancers. As we all know, prostate cancer is now the most common cancer diagnosed in Australia, overtaking breast cancer as the country's leading cause of cancer. And as much as we can do to drive the science which underpins the development of medicine, it's not the only consideration when we're talking about outcomes. Everything we do is futile if patients can't actually get access to the medicine that we make and develop. And we're still faced in Australia with a huge patient gap in Australia, with one report estimating about an 820-day gap between TGA and PBS reimbursement for often life-saving medicines. And this is where everybody in the room, everybody here tonight, has got a stake in that conversation. For the last 2.5, 3 years, we've been less together because we've all been a virtual world, but we're here tonight. This is the third ANZUP I've missed and just done virtually, but we're here tonight and we're together and we're live, and this is how to build the trust and connections and common pursuits which actually can drive the changes which we need to drive, such as the health technology assessment, which is just undergoing a review, along with the National Medicines Policy, which is undergoing a review. For those of you that don't know, the HTA is the model that the government used to decide what gets reimbursed in Australia and what doesn't. And the current HTA review, which we can all go and talk about to our Member of Parliament, is really aiming to reduce the time for Australian patients so they can access new technologies as early as possible, but also increase the attractiveness of Australia as a first launch country for new medicines. This will always and also increase clinical trial investment and placement of Australian clinical trials, which is always a good thing. And we were just talking about the average eligible patients, about 6% of eligible patients actually get onto a study. And then thirdly, to ensure the Australian assessment processes actually keep pace with the rapid advances in this technology. Patients, which is why we're here tonight, must be at the centre of that process so that these reimbursement decisions consider the impact and benefit of them medicines from the patient's perspective. For this to be realised, we do need to work together. We need to remove firewalls. We need to remove silos. We need to ensure all stakeholders, healthcare professionals, the pharmaceutical medical development industry, researchers, government, but most importantly, patients, have a seat at the table for these HTA reforms and beyond. And I mean the same table, not a side table or a table outside, the same table. Because the patient voice has never been more important. The patient voice has never been louder. The patient's voice can change things. And it's time now for that change because the patient's voice is no longer on mute. So thank you for letting us support this tonight, and see you all later.